Since the time of COVID, we've been approached by a lot of companies making digital diagnostic and digital therapeutic products. Now, many times when these companies are meeting us for the first time, they actually just want a regulatory or quality or clinical partner, and then they would work with them eventually after they have raised funds. So the first question that I tend to ask them is that, are you very clear about your go-to-market strategy in terms of the regulatory pathway? And to my surprise, often they say that we are not very sure about it. That's when we suggest them that you have to get a thorough due diligence done on your product before you get investors on board. It is important for you to know, or even for a potential investor to know, as to what are the indications for use that you are going to be pursuing, what is the patient population that you will cater to, what kind of specific clinical application you would be going after, and hence what is the regulatory pathway that would be applicable to you, what kind of classification, what kind of data you would need in place. Is it going to be a 50 patient study, or is it going to be 1,000 or 2,000 or 3,000, or no study, clinical study at all? So these are some very relevant questions that you need to think about and get answers to before you pursue future investments or allocate a certain type of budget for your digital therapeutic and digital diagnostic products. And this is specifically important now more than ever, is because there are a lot of different kinds of usage, that these products are being placed with. So they are sometimes placed as adjunct to drugs. They're sometimes like a standalone screening, or they could be so many other kinds of things that they may be doing. And it's very subjective as to the regulatory pathway that would be applicable to them. So it's important to know the answers to each of those questions and plan your budget very carefully. So if you have questions or you want to learn more about due diligence that Alexis performs, please do not hesitate to contact us. Thank you.